Greetings from Philadelphia. My name is Nicole Quee, and I'm the Program Director for the Pathology Residency, as well as the Vice Chair for Inclusion, Diversity, and Equity. I'm a Penn lifer, which means I came to Penn for medical school and just never left. So I might be a little bit biased when I say that Penn Pathology is really among the top in the country.
The biggest strength of the department really is the people. Penn, like other places, has great resources, we're in a great community, but it's the people that really make it a special place.
Working with outstanding pathologists is probably the key component of being here, and working with these two groups has been an immense joy for me personally.
Pathology was clearly something that appealed to me, and Penn was particularly strong.
When I joined here as a cytopathology fellow, I truly felt that I belonged. Everybody here in the department was really friendly and worked really together to provide the best patient care possible.
We all come from different backgrounds, but everyone has been very supportive and friendly. I couldn't have selected a better bunch of people to work with.
Every day coming to work is really fun. It's hanging out with all of your friends, but also doing pathology, so how could you get better than that?
You feel that everybody is sharing the same space, working as a team.
One of the things that really drew me to the program is the mentorship. They're really there to guide you and really foster your career development.
The accessibility of the leadership is astounding. They're some of my closest friends. They're very easy to talk to.
Everyone at every level is accessible at basically any time. From the rotation directors to the program directors, to our AP and CP chiefs, and even the department chair.
We even get a chance to sit down with our chair on a monthly basis for a cup of coffee and chat, which offers a direct line of communication with the top leadership.
I just want to provide resources, foster individual freedom and creativity, support you, and get out of your way. And that has worked well.
I think that really strengthens the program and strengthens our ability to, work as future leaders in pathology.
It was really important to me that I trained at an institution that valued physician scientists and actually had some examples of people who made that career work for them. And I think this place has all of that.
I've worked in 3 continents, and I found that the Penn pathologists to be probably the best teachers, inspiring and immeasurable in their caliber.
I try to maintain as being interactive as possible. I also try to use humor and bring some levity to what we're talking about. Sometimes my jokes work, sometimes they fail miserably, but I deal with that, and that's part of my learning as a teacher too.
We also have a great diversity of career interests and career paths.
Pathology is a really big field, and throughout the 4 years of residency, you get to really get to know every single area of pathology, and you can keep your options open throughout your residency.
Our anatomic and clinical pathology are both very strong, so if you're very undecided about what you want to do, that's not really a factor coming in.
I came in having strong interests in a CP specialty blood bank and an AP specialty hemopath. And I really loved that the program was supportive of residents' decisions to choose AP only, CP only, or AP-CP training based upon their interests.
There is, of course, a lot of history in the Department of Pathology, the medical school, one of the oldest in the country, but it continues to be at the forefront of many facets of pathology.
Our department had an individual, Peter Knoll, in the early 60s who made the first connection between genetics and cancer. And now we're using genetics to create cancer therapies. So these things were not just the residents are here and they're getting to see it, they're actually doing it.
Our residency program is really situated in the middle of everything. It doesn't hurt that Philadelphia is an underrated city.
Philadelphia is really a beautiful city, and it has now become one of my favorite places.
It's a big city, it's a diverse city. Any kind of community that you want to be a part of exists here. One of the best towns in America.
There's this philosophy here, I don't know how to really express it. People tend to come here for different reasons and they just don't seem to want to leave.
Since I've come back, I spent a lot of time here, I returned. I think this is a fabulous place to do any number of options in pathology in general.
Penn is really a family, and even when you leave, it continues to be a family. So once you train here, and if you leave, you become part of our extended family. And that means that we have a very large network of people that can help when it's time to apply for fellowships or time to look for jobs. That network helps our trainees immensely.
This is a place where you're going to be happy. This is a place where you're going to enjoy working. You just look at the program and you see the people who are residents here, they want to stay on, they want to be a fellow. I can tell you, like, if I had to choose again, I think this is the only choice I would have ever picked.
This place, these people are really my perfect match.
The research opportunities, the breadth and depth of the faculty here, living in Philadelphia, which is a great city, the choice was made for me.
It's been a distinct privilege working with such a fine group of clinicians and pathologists here at Penn.
I'm excited by the idea of many of you applying to the University of Pennsylvania, and when you eventually do join us, I know we're going to have a wonderful time learning from one another, inspiring one another as you progress through your chosen field of pathology.
Thank you for your interest in Penn, and I look forward to speaking with you again.
Penn Pathology is a family, and we'd love to welcome you home.